I'm a cardiothoracic surgeon. I primarily focus on cardiac diseases. I do pretty much the entire spectrum of heart surgery, including coronary artery bypass grafting. I do valve surgery, but my primary focus is aortic surgery. My hope and intention is to have a more multidisciplinary aortic institute that will integrate all the services and provide a single place for a patient to come to for all their care with regards to their aortic problems. What we can offer patients with regards to a particular aortic disease is changing, and it's rapidly evolving. Patient care is a phenomenal thing because you not only are able to give a lot back to the patients, but you learn a lot from your patients and their families too. And I think if you approach patient care that way, you come to realize we're all pretty similar. We all have pretty similar needs and desires and what we want from one another. Those are the moments for me that I intellectually and from a personal standpoint enjoy.